chest muscles here. These are called the pectoralis major muscle. The pectoralis major muscle originates at the sternum. It's going to insert in the intertubercular sulcus of the humerus. So it's going to do horizontal adduction, horizontal adduction. It's a big muscle. It's got two nerve supplies. It's got medial and lateral pectoral nerve. Okay? Then we go all the way back here. We'll go to the pec minor muscle, is right here. Okay, a pectoralis minor muscle is going to anteriorly draw the scapula in a downward type motion, downward in like oblique type motion. And it's also going to pull the ribs up when you do deep inspiration. So it's going to originate in the corticoid process of the scapula. That's going to insert, it's kind of weird, it's going to insert in either ribs 3, 4, and 5, 2, 3, and 4, or 2, 3, 4, and 5, depending on the person. Okay, depending on the person. Okay, it's going to be lateral pectoral nerve. Okay, like that. Okay, over here you see these muscles here, they look like saw teeth. Okay, it's the serratus anterior muscle. They call it the boxer's muscle. It's going to anchor the scapula down like when you're throwing a punch. Okay. All right, so if we're looking at this here, this is our deltoid muscle. Okay, the deltoid muscle is going to originate on the clavicle and spine of the scapula, and it's going to insert in that deltoid tuberosity. Okay, so it's going to give abduction of the humerus, abduction of the humerus. Okay, it's going to be innervated by the axillary nerve. Okay, I got a pen here. Okay. All right, so the muscles of the rotator cuff, okay, that they're right here, okay? Like, so just think, okay, just think of the word sits muscle, okay? Okay, the first S stands for supraspinatus. The first S is supraspinatus, the I is infraspinatus, the T is the teres minor, and S is the subscapularis. So right up here, this is the supraspinatus muscle. It's above the spinal scapula. So it's supraspinatus, okay? Supraspinatus muscle originates at the vertebral border, okay, of the scapula, and it's going to insert, okay, on the superior portion of the greater tubercle of the humerus. Okay, what it's going to do is it's going to initiate abduction of the humerus. Then the deltoid muscle will take over. Okay. Then we have here, right, the infraspinatus, right, the I, infraspinatus. Infraspinatus is going to originate at the vertebral border of the scapula, and that's going to insert a posterior greater tubercle. So it's going to give lateral or external rotation, of the humerus. Okay, the T stands for teres minor. Teres minor is going to originate at that axillary border of the scapula, and that's also going to insert in the posterior humerus, posterior greater tubercle of the humerus. So it also does external or lateral rotation, just external or lateral rotation. Okay, underneath, okay, we're going to have our, better picture, whoops. Right here is our subscapularis muscle. The subscapularis muscle is going to originate on the anterior side of the scapula, on that vertebral border, and that's going to insert in that intertubercular sulcus. Okay, it's going to do internal or medial rotation. Okay, so what the nerve innervation to the supraspinatus muscle is going to be the suprascapular nerve. If the infraspinatus muscle is going to be suprascapular nerve, teres minor is going to be axillary nerve, okay, and the subscapular nerve is going to innervate the subscapularis. Okay, there's another muscle here. It's right here. This muscle right here goes right under the triceps brachii muscle. This is going to originate at the inferior angular scapula, and it's going to insert in that intertubercular sulcus. It also does internal or medial rotation. It's the teres major muscle, okay? So it does exactly the same thing as the subscapularis, and it's innervated by the subscapular nerve also, okay? But for some reason, they don't include it in the rotator cuff, okay, muscle group. rotator scapulae muscle tells you what it does. It elevates the scapula. So it's gonna originate at that at the transverse processes of the cervical vertebrae, and it's gonna insert on that superior angle of the scapula. So it's gonna raise scapulas. Okay, your rhomboid muscles, rhomboid minor and major, these are the only muscles that don't have a tendon. They go right, the muscle just attaches right to the scapula, so that medial border. So it's gonna retract the scapula. Okay, they used to call it rhomboideus major and minor. So these are gonna go, they're gonna insert in the sides of the spinous processes on the upper thoracic region. Okay, a lot of these muscles here get very, very weak because everybody's sitting in a chair, they're always hunched over. You don't really use these muscles, so they get really, really tight. You might get some soreness in between shoulder blades. Okay, so what you do is put your arms out like that and bring it back as far as you can without dropping them and do circles. Okay, do like 10, and you go 10 the other way, and you're actually working these muscles. So you're gonna work the lactic acid out of them. Okay, so it'll calm them down. Okay. Okay, this muscle here is latissimus dorsi muscle. It's innervated by the long thoracic nerve. It's a big muscle on the back, but it doesn't do anything for your back. It's all arm movement. Okay, so it's going to originate at the spinous process of T7 all the way down to the sacrum. Okay, it's going to insert in the intertubercular sulcus of the humerus. Okay, so what it does is it's going to extend the humerus, internally rotate the humerus, and adduct the humerus. So extension, adduction, and internal rotation. Okay, so they call this a swimmer's muscle. They call it the swimmer's muscle. Okay, all right. Here first. Okay, so this muscle here. Now we're in the arms. So in that little white book of mine, all the muscles are grouped. So it's a lot easier if you group them. Okay, you group them. So right here, this is my. If I'm in your way, Shell. Okay. My biceps brachii, right? Biceps means two. Okay, so it's got two heads here. It's got two heads attended. Okay, it's got the long head here. The short head. Okay, so it's going to originate at the coracoid process. Okay, the scapula. The long head goes right through that intertubercular sulcus. It's going to insert in the glenoid cavity. Okay, so you got that glenoid fossa or cavity. You got the long head of biceps brachii muscle. So they call this the intertubercular sulcus or bicipital groove because the long head of biceps brachii tend to goes through there. And that's going to insert in the radius. So not only does it do flexion of the forearm at the elbow joint, it does supination, it does this motion. Okay, it's going to insert into that radius. Underneath the biceps brachii muscle, okay, and it's whoops, can't find it. Okay, so if we cut the biceps brachii muscle right here at the brachialis muscle. The brachialis muscle goes from the humerus and it inserts into the ulna. Okay, so what you're doing is it's right here. You're just getting just flexion. This is the main flexor muscle. Okay, right here. I don't even know if it's labeled. It's here. Right here is the coracobrachialis muscle. What it does is it's gonna flex the arm at the shoulder joint. Okay, all these muscles are going to be innervated by the musculocutaneous nerve. Oh, here's coracobrachialis right there. Okay. All right. Okay, so if we go antagonistic, right, to right flexion of the arm at the elbow joint, antagonistic would be extension, right? It would be opposite. Okay. So the main extensor muscle in the arm is going to be the triceps brachii, because we have a long head, a lateral head, and a medial head. Okay? The medial and lateral head are going to originate in the humerus. Okay, the long head's going to go to the scapula, and it's going to insert in the olecranon process. Okay, of the ulna. So the triceps brachii muscle extends the arm and also the forearm. Okay, the aconius muscle here just extends the forearm. Okay, so write this down somewhere. Okay, write this down. Okay, any muscle whose action is extension in the upper extremity. So any muscle whose action is extension, okay, is it's gonna be innervated by the radial nerve. So anything that's extension in the upper extremity is going to be innervated by the radial nerve, okay? So any muscle in the upper extremity whose action is extension is going to be innervated by the radial nerve. So extension of the arm, extension of the forearm, extension of the wrist, extension of the thumb, extension of the fingers, all innervated by the radial nerve. All innervated by the radial nerve. Okay? Does that look like steak? Is it steak? Right. I don't know why I don't have an anterior view. This is posterior, but I'll show you anterior view when we get to the lab next week. Okay. So this muscle here, right, this big thick muscle, it's called the brachioradialis. Goes from the humerus to the radius. Okay, and it's going to be a flexor muscle. Okay, it's going to be a flexor muscle. Okay, but it's innervated by the radial nerve. It's funny. It's innervated by the radial nerve. It's a flexor muscle. Okay, then we have our flexor carpi radialis. Okay, flexor carpi is flexing the wrist, right? Carpal's in the wrist. It's on the radial side. So flexor carpi radialis, it's going to flex the wrist on the radial side. Flexor carpi ulnaris is going to flex the wrist on the medial side. Okay, so the median nerve is going to innervate the flexor carpi radialis. Ulnar nerve is going to do the flexor carpi ulnaris. Okay, right. Okay. Also, what flexes the wrist is a palmaris longus muscle. Okay, median nerve innervation. So it's going to pull the palm up like that. Okay, the finger flexors. Okay, so flexor pollicis means flexion of the thumb. Okay, flexor digitorums, flexor the digits. Okay, so we have two ways we flex our fingers. Okay, so we got flexor carpi, flexor digitorum superficialis. It means it's superficial. So it's those tendons attached to the middle bones of the phalanges, right? The flexor digitorum profundus, right, is deep. So if someone's profound, right, they got a deep personality, I think they're a pain in the ass person, but anyway. So right, the profundus goes to the distal fingers, and it closes the fingers. So if you look at your tendons, when you move your fingers, the tendons move. Okay, so it's not the fingers that are moving the tendons; it's the tendons that are pulling your fingers. Okay, you ever see the first Terminator, with Arnold Schwarzenegger? That was a great movie, right? So it's like one of my favorite movies. So anyway, in the movie, right, he gets injured. Right? He's a robot covered with skin. He gets injured, but he's taking he's gonna fix his hand. So he goes and he cuts the skin off, and he takes like wire cutters, and he's moving the tendons, he's moving the wires, and the fingers are moving. That's actually how it works in your body too. Okay, this here is posterior. So the easiest way of doing this, right, follow the tendons back. So right here, these group of tendons, these are the extensor digitorums. So you come up like this, right? Look, extensor digitorums. Very easy. This one here is extensor digiti minimi muscle. So it's the little finger. Okay, little finger. So just pull it like that, right? So if you go up like that, so follow this up. Extensor digiti minimi. You're really never going to wrong. Right here is your extensor indices, right? You can extend your index finger. So you just follow that tendon up, extensor indices. Okay. These muscles here, are going to extend, right? They come all the way here. They're going to extend the thumb. So extensor pollicis muscles, extensor pollicis. So brevis means short, okay? Longish just means long. If you're looking at this one here, it's going to come to the joint right here, the proximal joint. So that's going to be our abductor muscle. So it's right here, if you follow it, right? Abductor pollicis. So longish just means long, brevis is short. Okay, brevis is short. Okay? If we go in the fingers, right? So our dorsal interosseous muscles are going to abduct the fingers. Okay, so these are our dorsal interosseous muscles right in here. Okay? On the opposite side, our palmar interosseous muscles adduct. They adduct the phalanges. Okay, they adduct the phalanges. Okay? If you look at opponent's pollicis muscle, you got an opponent's digiti minimi muscle, it does this. It does that. There's opposition. Okay? All right. And it's just, again, the actions of the thumb. So again, like last time, so the distal joint does flexion extension, right? The distal joint flexion extension. The proximal joint does adduction, abduction, and opposition. Okay? Right, so we climb, grab stuff. Try to do right? Try to do anything without your thumb. So like today, if you remember, try to button a shirt without your thumb. Try to tie shoelace without your thumb. Try to write without your thumb, okay? Try to hold utensils and stuff without your thumb, okay? It's a little hard. Okay, so we really don't touch on this, but we go over the deeper muscles of the back, okay? So in between our transverse processes, we have the transversality muscles, okay? Between our spinous processes, we got your interspinalis muscles, okay? The rotator muscles, okay, and the multifidus muscles, they don't just show the multifidus here, they're a little deeper, but it goes from the superior articulating facet of one vertebrae, skips a vertebrae, and inserts on the opposite side of the spinous process. It's for rotation, it's for rotors, okay? Right, so these muscles, right, look how small they are, right? They're for posture, okay? They're for stabilization, they're not for power. So look at, that's gonna skip down here. Look at your leg muscles. This is your femur. These are your adductor muscles, okay, whoops. Okay, these are your hamstring muscles in the back, okay? These are your abductor muscles, and you got the muscles in the front, okay, too. So you got a lot of muscles around your legs. They're made for power. So when you're lifting stuff, you're not supposed to lift with your back. You're supposed to lift with your legs. So you lift nose between the toes, right? Nose between the toes. If it's too heavy to pick up nose between the toes, what does that mean? It's too heavy, don't pick it up, go get help, right? So, when I'm at my practice, people come walking in limping, and they go, it's the funniest thing, I dropped a pencil, I went to pick it up, I threw my back out. Because it's the weight of your trunk, that's supposed to be bending like that, okay? So these muscles get real tight, pull the bone out of alignment. Remember, the nerves come out of here. The nerves will come out of here. All right, so I usually like to do this. This is why I don't like to screen up like this. All right, so. Okay, so I'm gonna just kind of draw this. Okay, so you know what a Scotty dog is, right? Those little terrier dogs, right? Scottish terriers. I'm gonna trace them out. That's Scotty dog's ear. That's his nose. That's his foot. That's his back foot. That's his tail. So I'll try to draw this as good as I can. So, okay, superior articulating facet, right? It's going to be a transverse process. Inferior articulating facet, his body, posterior, and you got spinous process. So it kind of looks like a Scotty dog, right? Okay, so there is a condition, it's called a pars interarticularis defect. Okay, it's when you break the pedicle. It's not an acute injury, it's a chronic injury. So like if you work in construction, you're constantly throwing wood on your shoulder, or maybe carrying packages up and down stairs. So how you do this would be like an oblique film. So instead of doing a lateral film or a posterior to anterior, the person's actually like this. So you're doing it, they're standing at an angle. And if the pars interarticularis is broken, Scotty dog will have a collar. Okay, Scotty dog will have a collar. Okay, so again, it's repetitive stress. I've seen it twice. The one guy he come in, he was riding his bike and he was in Newark, and someone hit him with their car. He flew up over the trunk and up over the roof, and the car kept going. The guy just left. Yeah, it happens all the time. People are assholes. It happens all the time. The car accidents all the time, they take off. Yeah, they take off. So anyway, in those days there were no cameras and stuff. So he came in, we shot a film because of trauma. He was okay, except for this we found. And this is not an acute injury, it's a chronic injury. So it didn't happen for a car accident. You know? So I asked him, I said, do you ever work construction? No. I said, you ever deliver a packet? No. I was an accountant my whole life. I go, well, this is usually repetitive stress thing, like constant banging. He goes, how about jumping out of a plane? I go, yeah. He was 82nd Airborne in Vietnam. That's what he did. When I had my own private practice, older guy came in, same, he had arthritis, so we took a film, same thing. I said, you ever work construction? No, I was an accountant. They're sitting all day long. I go, you ever in the Army? He goes, yeah, World War II. I go, what'd you do? 101st Airborne. So jumping out of planes, banging and rolling could cause this. Yeah. All right. Okay, so here's our scaling muscles. I'm not going to test you on this either. Okay, this is going to And these muscles will flex, right, flex the chin to the chest, a lateral flex, and do rotations, okay? And these guys are gonna originate at the transverse processes from C3 all the way down to C7. The anterior and middle scalene muscles will insert on rib number 1. Posterior scalene muscles will insert on rib number 2, okay? So it's the anterior, middle, and posterior scalene muscles. When I learned it was in Latin, so splenius anticus, medius, and posticus, we call it, okay? Sometimes you'll get what they call splenius anticus syndrome, okay? So the brachial plexus, okay, these are the nerves that come out, okay, from C5 to T1, okay? And they'll branch and go down the arm, So a lot of times, like an older kid will grab a younger kid around the neck and put him in a headlock, okay, and then the kid can't move his arm. It's called splenius anticus syndrome. 2 or 3 adjustments, the kid's fine. 2 or 3 adjustments, the kid's fine. Okay, gotta get the muscles to calm down, get off the nerve. All right, so that will do legs, okay? So again, in my little book there, okay, group them. It's so much easier if you group everything. Okay, so we start off with flexion of the thigh at the hip, okay? Flexion of the thigh at the hip. It's gonna be our iliacus muscles and our psoas major and minor muscles. Most people do not have a minor, okay? If you do, it's a little bit of a muscle and mostly tendon, okay? The iliacus muscle originates at the iliac crest and inserts into the femur, okay? The psoas major minor, they're gonna originate at the transverse process of the lumbar vertebrae and insert into the femur. So it's gonna do that. Okay, it's gonna flex the thigh at the hip joint. Okay, the innervation for these muscles, it's a T12, L1, 2, and 3 spinal nerve. Okay, because it's so close, the spinal nerves just do it. Okay, so next semester I'm going to give you mnemonics, but a T12, L1, 2, and 3 raises the knee. Okay, so I give you a booklet. It's about maybe 4 pages. Okay, that booklet, it shows you all the muscles in the upper and lower extremity, the spinal nerves, the peripheral nerves that branch off the spinal nerves that innervate those muscles, the action of the muscles, and how to test them and diagnose it. Okay, we teach you how to do deep tendon reflexes because you're looking for an upper or lower motor neural lesion. It's like in the brain, or if it's down in the spinal cord, or if it's out in the periphery. Okay, and we teach you dermatomal testing also. Those are nerve tests. Okay, those are nerve tests. If you know that packet, it's got cranial nerves in it too. So you know all the cranial nerves. You know what they innervate, what muscles they innervate, the action of the muscles, and how to test them. Okay, so when you're done with A&P2, if you know this packet, you can go into any clinical setting and do an upper and lower extremity evaluation and know what you're talking about and diagnose it. Okay, so we hit you hard with clinicals, but then when you get into your program, you already know that. So when it comes in with a stroke or a brain injury, you'll know right away what to jump on. Okay, all right, all right. So what's opposite or antagonistic of hip flexion, right? Hip extension, right? I almost fell. Hip extension, right? Okay, hip extension, that big cheeky muscle, gluteus maximus, right? We have to cut it here. Let's cut it here. Well, it goes to the issue of tuberosities, right? Look at this, right to the posterior portion of the femur there. That's the greater choke cancer there. Right, you got that little V or upside down triangle. Okay, that's a gluteal tuberosity right there that attaches to. Okay. So, like flexion of the thigh at the hip joint, iliacus, psoas major and minor. Extension of the thigh at the hip joint. Whoops, gluteus maximus. Okay. All right. So let's do abduction, right? Abduction of the thigh at the hip joint, right? Our tensor fascia lata. Okay. Little bit muscle. Right, iliotibial band here, right? The iliotibial band right here. A big tendon here. So, right, stands for, right? Tensor fascia lata. A lot of tense fascia. That's what it means. A lot of tense fascia there. Okay. You got you got a lateral femoral cutaneous nerve right here. Okay. So they teach people like with a cop with a baton or a nightstick. Someone's giving you a problem, you hit them right here, hit that nerve, it'll drop. Okay, so the leg will go numb. Okay, don't do that. Don't be mean. Okay, all right. So tensor fasciae lata, okay, and our gluteus medius and minimus muscles, abductor thigh at the hip joint, okay? Superior gluteal nerve. Gluteus maximus, inferior gluteal nerve, okay? All right, so we just did abduction, right? Gluteus medius, minimus, and tensor fasciae lata. Okay, now let's go into, okay, adduction. Okay, so we have our adductus longus, it's cut here, so adductus longus, adductus brevis, adductus magnus, gracilis, and pectineus, which is cut here. Okay, those muscles, those 5 muscles, okay, are gonna adduct our thigh at the hip joint. Okay, these are all innervated by the obturator nerve, except for the pectineus is innervated by the femoral nerve for some reason. Okay, all right. Okay. Okay, this long muscle is the longest muscle in the body. Okay, it's going to be the sartorius muscle. It originates at the anterior superior iliac spine of the ilium, and it's going to insert in that tibial tuberosity. What it does is it externally rotates and flexes the leg. Okay, it externally rotates the femur at the hip joint, okay, but it flexes the leg. Sartorius in Latin, it means tailor. So tailors, people used to sew, they would cross their legs, put the garment on their leg, and then sew. Okay, that's where that came from. Okay? Did I give you origin insertions of this? Tensor fasciae is going to be the anterior superior iliac spine and ilium. It's going to insert at the head of the femur. You know, fibula, head of the fibula. Okay? All right, let's go to the knee. Okay, so we're going to flex the knee. Oh, let me do the I don't test this, but rotation of the hip joint. It's going to be your piriformis muscle. Okay, all going to be from the ischium and going to go to the greater trochanter. So you got your piriformis muscle, your inferior and superior gemelli muscles, okay, and your obturator internus and externus muscles. Okay, so they're going to rotate. We're going to test you on those because they're real deep. Okay, the piriformis muscle here, okay, it lays over the sciatic nerve. Sciatic nerve is a big nerve. The spinal nerve roots that make up the sciatic nerve are going to be from L4 to S4. Okay, and they come in and make up the sciatic nerve. Okay, right above the top popliteal fossa, the sciatic nerve splits. The common fibular nerve and tibial nerve. Okay, common fibular nerve and tibial nerve. Okay, anytime you see fibular, it used to be called peroneal. Okay, so peroneus longus and brevis, those are the muscles that they're fibular longus and brevis. Okay, the peroneal nerve is called the fibular nerve now, because it's on the lateral side of the leg where the fibula bone is. Okay, peroneus is a Greek word, fibula is a Latin word. We want to make them all Latin now. Okay, all right. So if we go up here, right? Okay, so the muscles that extend the leg at the knee, right? They're all synergistic to each other because they do the same action. Okay, it's going to be on the top, rectus femoris. That's going to keep your femur erect, right? Rectus femoris. Vastus lateralis on the lateral side. Vastus medialis on the medial side. Okay, and vastus intermedius in the middle. So vastus lateralis, intermedius, and medialis. Okay, collectively they extend the leg at the knee. Okay, femoral nerve. Okay, opposite or antagonistic to extension, right? It's going to be flexion. Okay, we're going to flex the leg at the knee. These are our hamstring muscles. Okay, they originate on the ischiotubers. So going laterally is our biceps femoris muscle. It's going to attach to the head of the fibula. Then we got our semimembranosus and tendinosus muscles. They attach to the tibia. Okay, so this is the membranosus here and here. It's not two muscles, it's one big muscle. Okay, the membranosus is like a membrane, right? It's right here. The tendinosus lays on top of it, so don't get confused, okay? So semimembranosus, tendinosus, and biceps femoral make up your hamstring muscles. They flex the leg at the knee. They're innervated by the sciatic nerve, okay? Okay, when you're looking in the book, okay, remember, some muscles do main actions, but some muscles aid in other actions, okay? So right? So a lot of times people look, they'll say rectus femoris, action, extension, and flexion. And she's saying, well, how can something extend and flex at the same time? They're opposite, right? They're opposite. It covers two joints, okay? So the rectus femoris muscle, it extends the leg at the knee, but it also aids in flexion of the thigh at the hip joint. Because it's gonna, it attaches to the pelvis, the ilium, then it goes into the patella tendon to the patella, okay? So that's why, so don't get confused with that, all right? This tooth bugging me. Okay, let's go into down in the legs here. Okay, so this muscle right here, is the tibialis anterior muscle. Right? It's going to go from the tibia, and it's going to insert you right at the base of the first metatarsal, okay, and cuboids. So I mean, and cuneiform bones. So it does when it pulls you into inversion. So the foot inverts. Okay, so you're looking at your instep. Okay, that's going to be it's going to be the deep fibular nerve. Okay, so now what's the opposite of inversion? Right, it's going to be eversion. You're going to roll your foot the opposite way. Right, it's going to be your fibularis longus and fibularis brevis muscles. They used to call this peroneus longus and brevis. Okay, and it's going to be innervated by the superficial peroneal or fibular nerve. Okay, because the fibula bone's right here. So your lateral malleolus right there. Okay? All right. What the tibialis anterior also does is it dorsiflexes the foot. It pulls you up on your heels. Okay, it pulls you up on your heels. Opposite of that would be plantar flexion. You come up on your toes. This is your gastrocnemius, which covers two joints, and soleus muscles, covers one joint. Okay, most people don't have a plantaris. If you do, it's mostly muscle and a long tendon. Okay, all right? Right, so you have gastrocnemius and soleus muscles make you plantar flex. Okay, it's going to be your tibial nerve, Okay, so they think the people that have a psoas minor, okay, and a plantaris muscle, okay, are really good sprinters because that tendon's pulling you just like that. So they tend to be better sprinters. Okay, all right. So again, just like in the hand, very, very easy. So the thumb is called pollicis, the big toe is hallucis. So especially on a multiple choice test, it tells you flexor pollicis flexes the big toe, extensor pollicis extends the big toe. Right? We have an extensor flexor digiti minimi. That's the fifth phalange. Okay. Flexor digitorum flex everything. Okay. Extensor digitorum extends all the toes. Okay. So and right, you got your interosseous muscles also. Okay. So exactly just like the hand, And that is it for that chapter. So we are done. We're going to go over this next week in lab. Okay. So today in lab and then the next week in Tuesday. So today in lab, I want to go over the ranges of motion with the joint page. I think it's page 132. Okay. And then Tuesday we'll do that also. Okay, Tuesday we'll do that also. Then we'll go right into muscles. Then we'll review the muscles again. All right. So next chapter we're ahead. So I'm probably gonna next week I'll review muscles again. We'll swing by it again on Wednesday. And then we do blood, and then we're ready for the next test. Okay, we're ready for the next test. All right? Okay. All right. I know I wrote it on a board. I didn't get it on canvas for some reason, but I'll put it up there. It's appendicular skeleton from 111 to 122. Okay, I know I wrote it on the board, but somebody mentioned that it wasn't on canvas. So that's it today. I know we're ahead. We go study, a little bit.